Welcome to the Pegasus Learning Platform. Pegasus is your home for clinical simulation and learning resources. This quick timeout is for short study breaks and will cover ECG rhythm strips. Please know this is a quick timeout only. We cannot cover everything like bundle branch blocks, torsades, U-waves, etc., or explain everything like intervals and segments in this short video. The images are not to scale or exact. They're included to provide a visual cue only. In this scenario, systole means squeeze, diastole means decompress, depolarize means putting out a shock that makes the muscle squeeze, and repolarize means recharging so it can depolarize again. We're going to start with the structure and function of the heart. That will make understanding strips a little bit easier. You can see on this diagram that we have blood in the body. This is deoxygenated blood that needs to return to the right atrium, and we have oxygenated blood in the lungs that need to come into the left atrium. You have the right to breathe. What that means is the right side of the heart will pump blood to where you breathe. There's more information on all of this in a previous resource. So we have blood in the body, blood in the lungs that need to come back to the heart. They're going to come into the right and the left atria. The atria are going to squeeze and pump that blood into the ventricles. The ventricles will squeeze and pump it out to the lungs and out to the body. The atria, which is plural for atrium, squeeze and push blood into the ventricles. We know the atria squeeze and push blood into the ventricles, and it does that when the atria depolarize. That's atrial depolarization. It puts out a shock, and that shock causes the muscle to contract. So this P wave is atrial depolarization. We have the first step for our building the ECG strip. We know the P wave is a result of the atria putting out a shock and squeezing and pushing blood into the ventricles. So the two ventricles will squeeze and push blood into the pulmonic and systemic circulatory systems. So the atria squeeze and then the ventricle squeeze. The two ventricles squeeze and push blood into the pulmonic and systemic circulatory systems. So that's going to be our QRS complex. That's ventricular depolarization. So we have the second step for building our ECG strip. The atria depolarized, that's the P wave. Then the ventricles depolarized, that's the QRS complex. But the heart must recharge or repolarize so it can start the whole process over again. So while the heart's at rest, blood is passively flowing from the body and the lungs into the atria. The heart must recharge or repolarize so it can start the whole process over again. So we see the T wave is ventricular repolarization. We have the third step for building our ECG strip. The heart is at rest. We have the fourth step for building our ECG strip. There's a little bit more going on here as the heart repolarizes and blood is filling into the atria, getting ready for the atria to squeeze and push it into the ventricles. But for the purposes of understanding basic strips, we're going to have this as our fourth step for building our ECG strip. Atria squeeze, ventricle recharge. Pause. Now, the atria actually repolarize during the QRS complex, but for the purposes of this, we're going to consider the P wave as the atria squeezing, the QRS complex, the ventricle squeezing, the T wave is the ventricle recharging, and then a period of rest where the heart's refilling. Understanding dysrhythmias begins with understanding the basic ECG components. Let's see what happens when irregularities occur during different phases of this process. We've marked the QRS complex here, which indicates ventricular depolarization. And this is important because this is when the ventricles are depolarizing, putting out a shock, squeezing, and hopefully pushing blood forward. But I see here there are fibrillatory waves where the P wave should be. Well, in this case, this indicates that we're not getting a good atrial squeeze. The atria are fibrillating. That's why we call this atrial fibrillation, or a-fib. We've determined that the atria are fibrillating, Blood should flow from the atria to the ventricles, and then atria kick occurs when the atria give a really good squeeze and empty all the way. We would see the P wave here, but we don't. We only see fibrillatory waves. The atria do not give a good squeeze and empty all the way, so blood may remain in the atria and clot. That's why your patients with atrial fibrillation may need an anticoagulant. Let's consider what might happen if a clot does form. We'll look at the one that formed in the right atrium. If that slippery clot slips out of the right atrium, it can only go one place, forward into the right ventricle, and it would get pumped out to the lungs. That's why your patient may display signs of pulmonary embolism. Now we'll look at the clot that could form in the left atrium. If that slippery clot slips out of the left atrium, it can only go one place, forward into the left ventricle and out to the body. Your patient may actually display signs of DVT or a stroke. Atrial flutter and atrial fibrillation can look very similar. Atrial flutter may show multiple waves where a single P wave should be. And atrial fibrillation may show fibrillatory waves where a single P wave should be. And please note that sometimes these waves can just look like a single line when your patient has atrial fibrillation. Notice on this slide we have a T wave immediately followed by a QRS complex. Notice that this is a contraction of the ventricles prematurely, so we'll call this a premature ventricular contraction. The previous slide showed a PVC with a positive deflection. This one shows a negative deflection. It's still a premature ventricular contraction. This T wave is very vulnerable. It's a vulnerable time because the ventricles are supposed to be recharging. If anything occurs to disrupt this recharging on the T wave, the ventricles may not be able to repolarize. We notice on this strip we have QRS complexes. There are no discernible P waves. Remember, that's the atria. But there are QRS complexes. This is a fast heart rate, so we have tachycardia. The patient may have runs of v-tach with no symptoms. They may be symptomatic, or the heart could be so fast that it doesn't have time to fill with blood. Ventricular tachycardia can quickly turn to v-fib. Remember, QRS complexes indicate ventricular depolarization. We don't see this here. There are chaotic and coarse fibrillatory waves. They vary in amplitude. There's no definable QRS complexes, so we cannot have ventricular output. There's no cardiac output. If they are fibrillating, we must defibrillate them with a defibrillator. On this strip, I see no definable QRS complexes. There's no cardiac output. Remember, systole is squeeze. I see no systole or no squeeze here. This is asystole. We cannot cover everything, but we hope you found this helpful. Do not forget to review your terminology. There are more resources in your course on the Pegasus Learning Platform as assigned by your instructor, and if you need additional help, please reach out to your instructor for more resources. Please note that this is a brief overview only. This quick timeout is for a short study break, and understanding ECG rhythm strips involve more than this QT covers. Thank you for your attention to this resource hosted on the Pegasus Learning Platform.